Yes, it's communications, needle prick injury.
Okay, okay,
So,
thank
doctor, your task is that you are your colleague when he is working, when she is working in the hospital. She is a nurse, and sudden she is needle prick. Now she is very nervous. You want to talk with her. She is Sarah, and you are talking with the Sarah, your colleague.
Hmm.
So, do you want time or start?
No, I will start.
Okay, okay. Start.
Hello.
Hello.
Good afternoon. I'm Teresa Saras. How are you?
Doctor, I'm not fine, doctor. You know what happens? There is a needle prick occur in my hand. I'm really
So
happen. What
sorry.
will be happen to me? Don't you
I
know?
can see. Yeah, I see that you're a bit worried. I understand that. Really sorry what's happened to you, Saras. So
I'm begging to
yeah, I'm
doctor.
here today. Yeah, Sarah, I'm here today because I want to discuss with you about these needle prick injuries. Um, would you like anyone to join with us, Sarah?
No, 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 doctor. Just tell me how much I will be affected with the disease like hepatitis B, C, HIV. I want to know that. What is the chance I can get affected with this disease?
I absolutely understand your worry, and Sarah, let me tell you, when did you have this needle prick injury? Can you tell me?
Just now, 2 or 3 hours back, when I was just handling on the trolley, I get accidentally uh, needle prick injured occur.
Mm. So, Sarah, the thing is that yeah, there is a risk of those kind of infection. However, risk can be not that much. All right. So if you have taken the hepatitis B vaccinations, you have your enough antibody for the hepatitis B. It is
But I
quite safe for
forgot,
you.
I forgot about that I have given or not. Now,
Mm,
how much I can be affected?
that's really a good point. You let me know that. So you know what, hepatitis B 3%, there is, if you don't have any antibodies, or if you don't have taken any vaccine before, the chance of having hepatitis B from needle pricks of hepatitis B patients is 3%. However, we don't sure that whether our patients is having those kinds of bloodborne infections or not. So SARS, what we can do is that we can take the consent from the patient. We can also take the blood sample from you, and we can see whether the patient has any forms of blood-bound infections or not. We can also see that whether you have enough antibody, or you clear all the baseline infection or not. How does that sound to you, Sarah?
Yeah, I understand that. So I have to take the prophylaxis.
Mm-hmm. So that's a good point. You can take the, if you wish, you can take the prophylaxis, HIV prophylaxis. For unfortunately for the hepatitis C, we don't have any medications for that. However, the chance of getting hepatitis C from the injuries of hepatitis C patients can be very low, less than to 1%, maybe 0.3. I'm not quite sure about that. But I can give you the leaflet or pamphlet about all those, what is the risk after having needle prick injuries.
Okay, so what about HIV?
Yep. So HIV, we first need to know whether the patient is clear from the infections or not. And we also need to see that your baseline, all the infection has been cleared to your baseline test or not. Also, the HIV is really, really, the chance of getting HIV is quite rare. However, if you're still worried, I can arrange a meeting with occupational health specialist. They can probably guide you what you can do next, whether you need to take the medications, the prophylaxis medications. It can be the tablet you can take for a month. Um, so how does that sound? Are you happy for that? Having a conversation with occupational health specialist.
I'm really, really tensed. But if I affected with hepatitis C, what should I do?
Hmm. I can see, Soros, you look really stressed at the moment. Um, don't I want to say that after, even though I'm sure the risk is really low. However, if you catch HIV, hepatitis C infections, there is also antiviral medications. You can try it, and some of the antiviral medications are very strong. It can literally clear up the infections. We also have the infectious specialist doctor. If you want, if you're still worried or if you're still stressed with that, we can arrange another meeting so we can discuss with the infectious specialist about how far the risk can be after the knee break injury. How that does sound to you?
Yeah, that's nice. And I want to know about the tetanus. What is the risk of tetanus?
Tetanus risk. I'm not quite sure exactly about the exact figures of how the risk of the tetanus. But let me ask you: have you taken the vaccine, tetanus vaccines before?
Yeah, yeah, I have taken.
Yeah. So if you have taken tetanus vaccines and it's been within the 10 years periods and your wounds is clean, by that I mean is that the needle prick injuries, the wound is quite clean and it does not, it hasn't been contaminated with swines or animal dentures. So the risk of having tetanus is very low, Sarah.
Okay, okay, I understand. So what should I do now?
One thing is that I want to ask you: have you probably cleaned with tap water, running water for a good
Yeah,
amount
yeah,
of time?
I done that.
And have you disinfected with the proper disinfected, betadine solutions?
Yeah.
That's great. So what we are gonna do now is that first of all, we need to inform that to our occupational health, and then we need to take the consent from the patient to take the blood from them, from the patient to see whether the patient is cleared from all infections or not. We also need to take the blood sample from you just to see whether you have enough antibody for
6 minutes.
hepatitis B
Hmm.
or not.
Okay.
If your hepatitis B antibody is very low, we can give you immunoglobulin, hepatitis B immunoglobulin along with the hepatitis B vaccines, jab. All right, Sarah.
Okay, all right.
Okay. Do you have any more concerns or worries after our discussions? How do you feel?
No, no, I have no any concern.
Okay. Even though I understand that having a needle prick injury is really stressful, if you feel really stressful can handle by yourself, please don't be shy, or please do not forget you can have a chat with me again, even though if you feel like you can handle this pain anymore. All right.
Okay, all right.
Okay, so I'm going to give you leaflet and website about the risks after having needle prick injuries. Do not feel too much. We are gonna do everything necessary. We will make sure that your health is also does not affect because of these needle prick injuries. You can have a discussion anytime you feel stressed with that. Okay.
Okay, okay.
Thank you so much, Sarah. Bye bye. I hope you recover soon with that injuries.
Okay. 28 minutes. Sorry, 28, I mean, saying 8 minutes. 1 minute remain.
Oh,
So
okay.
first of all, your communication was okay, but you have given some wrong informations. So
All
when a
right.
needle prick injury, as usual, IRCAP, if possible, we introduce ourselves, repo, clarify the rule, attendance, permissions. Okay. So needle prick first, what she will do, she will be wash with the soap water and running water. That she
Mm-hmm.
done. Now I want to know the chance of having hepatitis C, B, and HIV. So rule player is telling that hepatitis B is 30%, hepatitis C is 3%, and HIV is 0.3%.
Zero
So
point
all
3.
are
Yeah.
3.
Yeah,
So
yeah.
hepatitis B 30, hepatitis C 3,
Three,
and HIV
three, and
0.3%. No.
zero
Okay,
point 3.
doctor,
Yeah.
what could I do? How can I take the post-exposure prophylaxis? Okay. So actually, I hope you washed your hands with running water and soap water because it is the first thing you should do for the prophylaxis, post-prophylaxis exposure. I did. This is very good. Always, we have to trace the source of the needle. So tracing is not possible because this is the problem. We could not trace it. I am asking everyone, and no one knows the needle came from. So it was during the trolley handling, lots of needle was there. So
Um.
tracing was not
Mm.
possible. It is okay. We
Okay.
can talk about the post-exposure prophylaxis. So for hepatitis B, it is according to your vaccination status. If you are vaccinated, it is according to the titer of HBs antibody. If it is more than 10 MIU per ml, international unit per ml, no post-exposure prophylaxis is needed. But if it is less than 10, we need to take a booster dose for hepatitis B vaccines. But if you are not vaccinated, you need to take the vaccine and hepatitis B immunoglobulin within 72 hours of exposure. So first we will do the titer, that is vaccination status. If it is more than 10, not needed. But if it is less than 10, we need to give booster dose. And if not vaccinated totally, you need to take the vaccine hepatitis B immunoglobulin within 72 hours of exposure. Now about it regarding hepatitis C. Regarding the hepatitis C, unfortunately, there is no post-exposure prophylaxis, but we can discuss it with the doctor and hepatology doctor. We can do the PCR to know whether you got it or not. And luckily, there is a treatment for that. What about
Mm.
HIV? As you know, the chance of having HIV from a needle prick injury is very less. That is 0.3%. Are you with me? Okay. So if only we are working in high risk areas, we will discuss it with the doctor. They may give you 2 or 3 antiretroviral medications for 4 weeks or 28 days. So will HIV, we will tell that is 0.3% very rare. But if it's high risk area for HIV, then you can take with the permission or consult with the doctor the antiretroviral medications for 28 days or 4 weeks. Now, okay, about tetanus. And tetanus is also one of the post-exposure prophylaxis measures according to your immunization status. If you are immunized last booster dose within 5 years, you told me 10 years, it will be 5 years. You will not take anything, but it is more than 5 years, you will take a booster dose. So if I
Mm.
immunized last tetanus within 5 years, so I don't need. If not, then I need to take the booster dose. But if I am not immunized in tetanus, what happened? You will take both of them, the vaccine and the tetanus immunoglobulin. Am I clear so far? Okay, doctor. Next, what I do after prophylactic discussions? Then you have to fill the proper incident form. You have to document everything. For example, you have to mention the details of the incident, the time, date, and the place. Where exact in your body and wherever it is exposed superficially or deep, whether you know the source or not. Also, what kind of needle or syringe, whether you have provided first aid or not, whether it is contaminated or not, and you immunization status. All this you have to document. Then I will document where the incident form occur, everything details, time, incident, date, place, my immunization status. It is superficial or deeply, whether the source I know or not, needle or syringe, what have provided first aid, I have taken the treatment. These are my immunization status, everything fulfill a form. This will, I think, then ending will be maybe, do you have any other concerns? So shall we summarize on needle prick injury? Lots of website, trustable website leaflet we will give. So this is all about needle prick injury. Thank you.
Thank you.
Hmm.